Your swollen leg could kill you in the next 24 hours. I know that sounds dramatic, but last month, a 42-year-old patient walked into my clinic with just a little calf swelling. But within hours, a blood clot from that leg traveled to her lungs. She survived, but barely. And here's what terrifies me. 1.8 million Indians develop dangerous blood clots every year, and most ignore the early warning signs. I'm Dr. Sumit Kapadia, vascular surgeon, and today I'm showing you the 3 definitive signs that your leg swelling has crossed from normal to life-threatening. And by the end of this video, you will know exactly when to stop waiting and get emergency help. Before we start, make sure to hit that subscribe button so you never miss critical vascular health information that could save your life or someone you love. The sign number 3 is your skin is telling you that something's seriously wrong. Most people think that swelling is just about puffiness, but when I see these specific skin changes, I know we are dealing with advanced vascular disease. Look at your lower legs right now. Do you see any of these 3 warning signs? First, a brownish staining near your ankles. This is not just a bruise, it's called Hemosiderin staining. And it means that the blood cells are leaking out from your damaged veins and your circulation is failing. Second, that skin feels thick, tight or hard. In medical terms, we call this as Lipodermatosclerosis. Your leg might even look like an upside down champagne bottle. That happens when chronic swelling damages the tissues beneath your skin. And that's a comparison of a normal leg with a champagne bottle leg shape. The third are white scar-like patches, which in medical terms are called as Atrophie Blanche. It means that your skin is starved of oxygen and is beginning to die. And here's the worst part. When swelling gets this severe, venous ulcers develop. Ulcers are open wounds usually above the ankle that simply won't heal no matter what cream or bandage you try. I treated a 55-year-old teacher last year who had an ulcer for more than 8 months before seeing me. Imagine 8 months of pain, infection, and inability to work. We fixed the underlying vein problem and her ulcer healed in 6 weeks. So if you have any of these skin changes, you need a vascular evaluation immediately. This is not cosmetic. This is your body warning signs. Have you noticed any discoloration in your legs? Please comment and let me know. Now, coming to sign number 2, where only one leg is swollen, and that's what's terrifying. So here's a simple rule that could save your life. If both legs swell equally, it's usually not an emergency. But if only one leg swells up, go to an emergency room now. Why? Because when swelling affects only one side, it means there's a localized blockage. And the most important and dangerous cause is deep vein thrombosis or DVT. That's when a blood clot forms in your deep veins, usually the calf or thigh, and it blocks the blood flow, causing rapid swelling, pain, and a heavy feeling in just that one leg. But here's why your DVT can kill you. If a piece of that clot breaks off, it travels through your bloodstream straight to your lungs, and that's called a pulmonary embolism, and it can be fatal within minutes. So remember, sudden swelling in one calf or thigh with pain, especially when walking, and with presence of warmth, do rule out deep vein thrombosis. And if you see any of these symptoms and signs, don't wait for the morning, don't Google it, go to an emergency room immediately. A vascular surgeon will perform a color Doppler ultrasound and a few blood tests to confirm or rule out DVT. And in this situation, every minute you delay increases your risk of pulmonary embolism. I have seen patients who waited just one day and ended up in the ICU. So don't be that patient. But well, not every asymmetric swelling is DVT. It could be due to other causes as well. Lymphedema, which means blockage in your lymphatic system, which usually gives rise to a more firm but persistent swelling. The second such cause is Baker's cyst. People who have arthritis of the knee, they have a fluid collection behind the knee, which it ruptures and moves on to the leg. And that can also give rise to swelling. Remember, you cannot diagnose these yourself. So If you have swollen leg on one side, it always needs professional evaluation. Have you ever checked if your legs are the same size? Try it now and let me know in the comments. Moving to sign number 1, which is the most important test you can do right now. It is called as the pitting edema test, and it takes just 5 seconds. I want you to do this right now. So here you can see I'm demonstrating this test, how to check for pitting edema. When you press either your index finger or thumb over your shin bone for just 5 seconds, lift your finger up and look closely. Do you see an indentation or a pit? If that pit stays for several seconds, that can be really dangerous. Sometimes normally also we may have some amount of swelling. If you're standing whole day or even if you had salt in your meals, your skin will feel puffy. This especially happens with many females. But when you press it, the skin bounces back immediately within a few seconds. That's called as normal fluid retention. But when the indentation stays for more than 10 seconds, sometimes for 30 and sometimes for a full minute, it means that fluid has built up faster than the body can remove it. And that is the difference between a normal pedal edema and a pitting edema that signals that something deeper is wrong. And the most common vascular cause I see is chronic venous insufficiency, when the valves inside your legs stop working properly, and so the blood collects or pools down in your leg, giving rise to edema, which is usually pitting. And in case of deep vein thrombosis, you will see that although there is edema, it doesn't pit so very easily. Usually the muscles also become a little firm. These are signs that suggest that deep vein thrombosis is happening inside, and that's when you should catch it early. But even these signs of fluid retention due to chronic venous insufficiency or valve damage can eventually progress to skin changes, ulcers, and permanent damage. But the good news is that CVI is highly treatable when caught early. We do offer many minimally invasive procedures to restore normal circulation and take care of these faulty veins. So if you have pitting edema, make sure you do go ahead and consult a vascular surgeon. Let's quickly recap the 3 warning signs that your leg swelling has become dangerous. Sign number 3 is skin changes like brown staining or thick skin or even white patches or sometimes ulcers. Sign number 2 is one-sided swelling, especially with pain, warmth or redness. And sign number 1 is pitting edema that leaves a dent when you press it. These are not signs that you should ignore. Early diagnosis does help in preventing complication, and hence you can literally save your life. So your action plan starting today: first, do the pitting test right now. Check both legs. If you see persistent dents, book a vascular consultation this week. Second, measure your calves using a measure tape around the widest part of each calf. If the difference is more than 2 centimeters, that can be significant. It needs to be checked further. Third, photograph your legs. Take clear photos of any swelling, discoloration, or skin changes. This will help you track progression over time. But when should you go to an emergency? Sudden one leg swelling with pain, difficulty in breathing or chest pain, or if you have fever with leg swelling and rapidly worsening swelling over hours, these are the signs that it means you need to go or rush to an emergency hospital near you. Don't wait even for the next day. If you feel this video helped you understand leg swelling better, do hit that like button and subscribe so you never miss critical vascular health information. And do share this with someone who needs it. You might just save their life. Remember, your legs are talking to you. Are you listening?